Hello, everyone. Welcome to TALRadio. This is me, RJ Saankhya, hosting through the interview today. In a world that often feels overwhelming, there is something incredibly powerful about witnessing the spirit of children, their unbreakable smiles, and their capacity to inspire us all. And it is precisely this spirit that the Children's Hospital Orange County Foundation cherishes, nurtures, and protects with unwavering dedication. So, for decades, the Children's Hospital Orange County Foundation has been at the forefront of pediatric care, healthcare, making a lasting impact on countless young lives. So, today I have the honor of hosting Mr. Douglas J. Corbin, the Senior Vice President of the CHOC Foundation. Mr. Corbin has played an instrumental role in driving the Foundation's mission forward, mobilizing resources, and creating transformative programs that make a genuine difference in the lives of children and their families too. So, without a further ado, let's welcome Mr. Douglas J. Corbin. So, hi, Doug. How are you doing?
I'm well, Saankhya. How are you?
I'm doing great too. So let's dive into the series of questions that will shed light on the foundation's journey. But first of all, I would like to ask you something about your background and how have you come to join CHOC?
Wow. Let me try to do this in 2 minutes. I played baseball at Pepperdine University, and when I didn't get drafted to play professionally, I had to do something else. So I went into coaching. That lasted about 6 months, and then I went into the record business. And while I was in the record business, I was approached by World Vision to put a group of recording artists together and go to South Africa and see the work that they had done. And so we did that. This was in 1983. And the experience literally changed my life. To go over there, to see the work that they have done, to see the places that they hadn't been to yet, and what the tremendous need was. I remember after 2 weeks in South Africa, being on the plane coming home, and almost like an audible voice saying to me, "You've got to do more with your life." And that was the moment for me where I said, I need to get more involved in charitable work. In 1990 is when I really started doing some consulting work. And then I became the assistant vice chancellor at Pepperdine University for estate and gift planning, and then moved into my own consulting group. Formed that company in 2003, where we specialized in a thing called planned giving, where we work with people on their estates and work with advisors and that sort of thing. And it was while I had that company that I met somebody from CHOC, and that was, I think, 2007. And they asked me to come do some consulting for them. Usually consultants, you'll go in and you'll work for 6 months or a year. But I ended up sticking with CHOC for 10 years there before I was asked to run the foundation. So that's kind of what brought me to CHOC, and I started running the foundation in 2018.
That is wonderful. So give us a brief about how exactly CHOC improves child healthcare, and tell us about a few programs as well.
Well, we are one of the top pediatric hospitals in the country. CHOC was put together in 1965. Many children's hospitals, especially the ones on the East Coast, started in the 1860s. Hospitals like Boston Children's Hospital, Philadelphia, and so forth. So we're relatively young in that regard, but we've already made a tremendous impact and really leading, I believe, leading the country in our commitment to pediatric mental health. That is the thing right now that you can't talk to anyone these days without mental health affecting either directly coming from their family or somebody that they know. So it's a huge, huge crisis. And about 7 years ago, we opened up the first pediatric mental health inpatient facility in the country, from what I understand. And we have 18 beds for children anywhere between the ages of 5 and 18 that are a threat to themselves or a threat to others. And then we also have an outpatient program too to help parents deal with what they have to go through. So we've got 6 different institutes, neurology, oncology, cardiac, orthopedics, and also research is going to be one of our institutes as well. But it's the mental health issue that really is drawing many of us and our energy right now.
That's amazing on, how many different factors that you're considering for a child's well-being. So could you tell us about a specific case or a story that exemplifies the impact of the foundation that has had on a child's life?
Wow. Gosh. I don't think of one in particular comes to mind. There's a whole bunch of stories of children who came in and the situation was dire. And CHOC saved their lives. I mean, I can tell you that kind of wherever I go, if I meet somebody that, says, well, what do you do? I said, well, I work at Children's Hospital of Orange County, CHOC. I can't tell you how many times someone has said to me, well, your hospital saved my child's life or my grandchild's life or made their lives better. The thing is, only about 6 to 8% of the children in Orange County ever pass through our doors, and that's a good thing from that standpoint. We're there when families need us. It's a necessity, and that's the thing that we, as a foundation, are responsible for, is raising money for the hospital so they can advance the work that they're doing to help save more children. So I'm sorry I'm not coming up with any, one particular story, but there's just so many, cases of kids that now are thriving adults because CHOC was here in our community.
That's really touching. So among the children, who exactly are eligible to avail your services and how can they approach you?
Everybody. So St. Jude's does a great job of getting the message out that they don't turn any families away. Well, either does CHOC. So, I'd say probably, close to 2/3 of all our patients are Medi-Cal patients. Families don't have a lot of money and so forth. And you can imagine when a child has to come in for cancer treatment or something, really serious, how much money that costs. But we do not turn families away. We treat everyone, and we treat everyone the same. And that's why we need to get out in the community more and tell people what we're doing and why we need their financial support to help attract the best possible physicians out there, to develop the best programs so families don't have to leave Orange County to go back east for a particular treatment. We want to have everything here so the families can stay here with their child.
That is so wonderful on how you don't have any limitations or specifications, to provide healthcare for children. And that's
Right.
beautiful. So what strategies does the foundation employ to ensure access to quality healthcare for underprivileged children?
Well, like I said, everybody's treated the same. So, when people come through our doors, we, like I said, we don't turn anyone away. So it's pretty consistent, that way.
Yeah. So how do you ensure the quality?
Well, you ensure quality by getting the best possible physicians, best possible nurses. We have some real rigorous requirements in terms of safety and so forth, making sure that children, when they're here at the hospital, when they come into their rooms, that it's a safe environment, clean, all those things. So we pride ourselves and we take safety and quality care very, very seriously.
Wonderful. So, what challenges does the foundation face in its mission, and how do you navigate them?
Well, it's a very competitive environment in Orange County, as it is in a lot of major cities. You know, there's a lot of wonderful, wonderful charities that are here to serve, their constituents. So it's, to get somebody to say, hey, yeah, we're going to commit ourselves to support CHOC. It's really, the success of philanthropy with the public is about storytelling. And it's really being able to share, what we're doing, what we aspire to do, stories of how we've saved children's lives, and then just hope that individuals connect with that and say that they want to support us. So that's the competition for the philanthropic dollar in Orange County is probably, the biggest roadblock, because our mission, in my opinion, is second to none. I mean, there's what's better or what's more important than the health of a child.
Great, Doug. So, how does CHOC collaborate with other organizations or hospitals, to maximize its effectiveness? And also, would you like to mention few of your strongest collaborations so far?
Sure. Well, there's a lot of foundations out there. The Arduous Family Foundation, Pacific Life Foundation. There's just wonderful, wonderful, foundations in our community that step up and support us. We get a lot of support from corporations like Panda Express and Costco, and it's just too many to mention right now. So yeah, I mean, the support of the community has been really, really tremendous. And our job is just to connect with more and more people.
Great. So can you tell us about some of your upcoming initiatives or projects that you are excited about, and what impact do you aim to create through them?
Well, like I said, growing our pediatric mental health program is really, really important to us. Another initiative we have right now is around wellness. And, it's one thing treating a sick child, and it's another thing being able to provide information and services, programs that prevent your child from getting sick. So areas of nutrition, things like, aromatherapy, acupuncture, integrative medicine, beyond just Western medicine, but integrative medicine. We would love to be able to put together, cooking classes for families on a budget, where kids can get better food to eat and that sort of thing. So for the underprivileged in the community, one of the things that I've been, thinking about is starting a fund that would really take care of the underserved in our communities, where they don't have to worry about, paying to attend a class, that they could come in, learn, and really, take care of their families. So being able to teach families about nutrition, exercise, just health and that sort of thing, I think is a big, big deal. And that's another area that CHOC can be a leader in nationally on.
Great. So tell us some ways to support or give to the foundation.
Well, I obviously cash, if that's what you're asking, Saankhya. People can give, cash. They can donate stock. They can give gifts of real estate. People can support CHOC through their estate plans. You can't take it with you, right? And so a lot of people do planning to say, okay, I can't take it with me. How much do I want to leave? How much do I need to live on, me and my spouse? How much do I want to pass on to my kids? And then whatever's left over, I want to be able to direct that to charity, So that's a great way for people to support their charities, is just be kind of mindful and sensitive to, leaving something in one's estate plan, will, living trust, in addition to the cash gifts.
That's wonderful. So we're almost done with the questions, but before we leave, I'd like to ask you a personal question. So your everyday life or work must consist of interacting with wonderful kids, right? So it's heartwarming to even imagine how fulfilling that work must be. So tell us about how rewarding this must be for you.
Oh man. Well, I'm actually retiring in 6 weeks. So
Oh,
I'm looking back on I'm in that stage where I'm looking back on my career of 33 years in this particular field, and it really, it's just been a blessing for me. It's being able to serve children. I just to have had the opportunity to have committed my life to this cause is just something that I'm so grateful for. It's just been an amazing ride, an amazing journey, and something I'm going to look back on and be very grateful that I had the opportunity to get involved in the world of charitable work.
wonderful. So it has been a really amazing time connecting with you and knowing about the great work that you do. So thanks a lot for taking time for us.
My pleasure, Saankhya. I appreciate it.
Also, please keep up the good work that you're doing, and also congratulations on your retirements. Hope you
Thank
have a
you.
wonderful retired life, Douglas.
All right. Thank you, Saankhya. Appreciate it.
Thank you. Thank you so
All right.
much. So that was Mr. Douglas J. Corbin, Senior Vice President of Children's Hospital Orange County Foundation. Hope you find this interview insightful. For more such interviews, stay tuned to TALRadio, powered by Touch Your Life Foundation. And this is me, Saankhya, signing off for today. Take care, you all.